Welcome to Connect Genetics, a web-hosted genetic counseling consulting service that provides prenatal and cancer genetic counseling for patients. Your patient will interact directly with our board-certified genetic counselors via telephone and through a web-hosted presentation. Your patient will discuss his or her family history with a genetic counselor, who will draw a diagram or a pedigree of the family history to assist in assessing the inheritable risk for your patient. Based upon the reported family history information, screening options will be discussed to help reduce or better clarify your patient's specific inheritable genetic risks. Your patient will be presented with a general overview of basic genetic concepts such as chromosomes, genes, and inheritance. Depending upon the type of genetic counseling being provided, the patient will receive various screening and testing options for their specific circumstance. Here are some of the highlights of a prenatal genetic counseling session. An overview of how chromosomal trisomy can occur and the maternal age effect. The benefits, risks, and limitations of the screening and diagnostic options available to her in her pregnancy are discussed. The various maternal screening options, such as first trimester nuchal translucency and maternal serum screen, AFP, and integrated screening options with their respective detection rates, are discussed at length. What can and cannot be observed on ultrasound is presented. Appropriate population screenings, such as cystic fibrosis and hemoglobinopathies, are presented with information regarding specific ethnic background detection rates. Diagnostic testing options, such as chorionic villus sampling and amniocentesis, are discussed with information presented regarding detection rate and risks. Here are some of the highlights of a cancer risk genetic counseling session. Patients referred for cancer risk counseling will receive an in-depth explanation of the development of sporadic, familial, and hereditary cancer. Your patient's family and medical history will be collected for identification of high-risk patients. In order to demonstrate the benefits of testing, patients receive an overview of targeted surveillance options for mutation-positive individuals. High-risk patients receive an explanation of the process of genetic testing, including the benefits and limitations of the applicable tests, informed consent, and an overview of the possible results. Your patient will receive a personalized risk assessment. Patients with a high risk can be referred for appropriate testing options. Informed decision-making is made possible through the educational material provided. A letter will be provided for each patient summarizing the family history, relevant risks, and points of discussion for the patient's medical record. To obtain more information or to schedule an appointment, please contact us at the information below.